I know most of us have heard cataract, like we've been hearing cataract, even if it's not from our friends, or maybe we've heard that our grandmothers or our grandfathers or someone that we know has cataract. So today I'll be talking about cataract, the types of it, the causes, the things that we do, and the treatment for cataract. So I have a model here which I'll be using to demonstrate or to show you the things that you need to know about cataract. I know for most people they don't know cataract. Today we get to know what it is and the things that causes it. Yeah. So this is our model that we'll be using. So this is the eye. I mean, this is the whole eye, your eye. This is how it is. Yeah. So I'll be using this model to show you what you need to know about cataract. So this is the eye, and we have the cornea here. The cornea is the transparent part that we see, I mean the front part of it. And this white part, the skin of the eye, is called sclera. So that's what we see for grown-ups. Most grown-ups, it has turned brown, or in kids you see that it's very white. So this is what we always talk about, the sclera, and this is the cornea. So when you open the eye up like this, you see that we have the cornea over here, as I was talking about. This is the transparent part here. And we have the iris. The iris gives the color of the eye. So most of us, we know that we have a dark brown eye. This is where the dark brown color comes from. For white, some of them have blue, others green, gray, and then brown. So this is where the color of your eye comes from. It's called iris. Today what I'll be talking about is this. This is called the lens. You see, it's a transparent part of the eye. So with this, the eye has to adjust itself when you are looking at things at near and at far. So how you see it this way, when you are looking at things closer to you, it will adjust itself and become bulky, and it will help focus the things that you are seeing onto this part called the retina, and the retina then will send information to your brain. Yeah, so that is it. And when you are looking at things afar, it will thin up for the things that you are seeing to focus on the same retina for it to be sent to your brain. So as you are seeing, for most people, when they are born, it's transparent as this. That's why we call the lens. Yeah. But as you grow and as we do other stuff, for some people, it can be smoking, drugs, and other things. It can also be a trauma to the eye and a whole lot. I'll be talking about it in details, but this is it. As you grow, it thickens up, and then the transparency, you start to lose the transparency. So it's like just like this. It's being transparent, you start losing, and then it will become opaque like this. So light is not able to pass through to get to the retina. Yeah, and for the cataract, as I said, we have types of it, depending on how it happened and where it's located, okay? So we have posterior subcapsular, we have nuclear, we have cortical, we have congenital cataract, we have traumatic, and so many others, depending on how it happened. So if, let's say, a child is born and the lens, which is supposed to be transparent, is opaque, then we call it congenital cataract. So most of our grandfathers or our grandparents tend to experience, or the lens in their eyes tend to become opaque, and with that, that's where we get the names from. So depending on where it happens, then you can name it. So if it's in the center, you can say that it's a nuclear cataract. Okay. Today we won't talk about the types and all that, but I just want you to know that cataract happens with the lens and all that. Or with the causes and all that. For some people, it can be infections. So when they have infections in their eyes, it can cause the transparent lens to be opaque. And for some people, it can be trauma. When they are hit in the eye with a blow or maybe a sharp object or something, the eye tends to become opaque. And for kids too, instead of it being transparent, it gets to be opaque. Yeah. And for some people, diabetes can change the oxidative state of the lens, causing it to thicken up and then be opaque. So diabetes can be a part of it. And for other people too, it can be a prolonged use of drugs like corticosteroids and other things like corticosteroid eye drops or the oral ones. The only treatment that we have now is surgery. Yeah. For some people, it can be glasses at the initial stage. We tend to give them glasses to help them with their vision, because when you start having cataract, for other people, it can be so small that they won't even experience any changes in their vision. Just that you start seeing that their vision starts decreasing little by little, little by little. So by the time that they realize that they don't have their vision, then it will be so late or something. But the good news is that we have surgery that can reverse everything. So when the surgeon or the ophthalmologist opens the eye up, so with this, when you close it up like that, so the ophthalmologist will make a small incision over here and open it up and take this lens out of it and input an artificial lens into it. It's not a scary something, it's just a simple procedure that helps people, I mean, when they have cataract and all that. Yeah, so that is it. So in case you notice any reduction in your vision or reduce the vision, you can visit the nearest eye clinic or your eye specialist for an examination. That's all that I have for you today. I hope you learned a lot for today. Don't forget to like and subscribe. Bye.